There's not an ambulance available at all. That's a problem. We could really find ourselves in a bad situation.
For months, healthcare facilities have been struggling to find enough staff. But for one medical provider, the pandemic is putting the pinch on something else. Thanks for watching the news at 6. I'm Meg McLeod.
And I'm David Custer. The global semiconductor chip shortage has caused major problems for the automotive industry, halting production of cars and trucks.
One paramedic tells TV5's Rachel McQuarrie he has more employees than he can get on the road.
So we're kind of in a little bit of a different situation than many of the others.
The Michigan Association of Ambulance Services is dealing with a shortage of paramedics. Colby Miller, the CEO of Medstar, says his issue isn't necessarily staffing, it's actually getting enough ambulances.
Because the vehicle chip shortage, we've got more employees than we can put in some of our vehicles during some of our shifts. So now we're having to catch up on vehicle production and vehicle access by buying other ambulances just to put the number of employees that we have.
COVID-19 has impacted car manufacturing. Vehicle chips made overseas have slowed, causing a backlog of people needing new vehicles and waiting longer to get them. Even though he has enough workers right now, Miller says staffing is a concern for many smaller EMT services, especially in rural areas.
We need state legislatures to understand that EMS is a vital service in the communities, and expecting us to operate on Medicaid money that is 20 years since our last increase is just an incredible expectation.
He says that's something that should change for the sake of people needing help during emergencies.
When there's not an ambulance available at all, that's a problem. And in the smaller areas, the smaller rural communities, and in some of the cities where the healthcare economics don't support the growth or the investment in personnel, we could really find ourselves in a bad situation.
That's why Michigan EMS agencies are asking Michigan leaders for a $10 million funding increase to help them better cover costs, pay EMS employees better wages, and recruit more staff. Something Miller hopes happens. He says in his area, Genesee and Metro Detroit, his paid training program has helped retain staff, which he admits might not be easy for other areas to do, but he hopes that issue can be addressed along with the chip shortage. Miller says that he could add another 20 ambulances to his fleet, but he says to do that, it might take a while.
I think once the chip shortage on the manufacturing side gets straightened out, it will improve, but I think it will be a while before the backlog is resolved.
In Flint, Rachel McQuarrie, WNEM TV5.
According to Goldman Sachs, the chip shortage is expected to last well into the fall and possibly into 2022.